Good morning all. Myself Sheena Thomas. I'm working as an assistant professor in College of Pharmaceutical Sciences, Dayanand Sagar University. Today I would like to take a lecture on the topic pharmaceutical care. So I'll be sharing the screen for the same. So this is pharmaceutical care concept. So first of all, I would like to start with the definition of pharmaceutical care. It is nothing but the responsible provision of providing drug therapy for purpose of achieving therapeutic outcome for the patient, which finally or ultimately helps in improving the quality of life of the patient. So what are the outcomes which is needed for any kind of disease? Outcomes again can be divided into positive outcomes and negative outcomes. Positive outcomes include the curing the particular disease, sometimes eliminating or reducing the patient's symptoms, slowing down the progress of a particular disease or preventing the disease as such or preventing the symptoms, especially in case of communicable. The pharmaceutical care is not a single process or a single healthcare professional cannot perform the pharmaceutical care. It is a teamwork where all the healthcare team members has to put their effort. So it is a process in which a pharmacist, who is the major element in providing the pharmaceutical care, has to cooperate with the patient as well as other members of the healthcare team in designing, implementing and monitoring a therapeutic plan for the patient, which ultimately helps in producing therapeutic outcomes for the patient. So in order to design this particular plan, three major functions has to be monitored, which include one is identifying the potential drug related problem, how this drug related problem can be resolved, and how to prevent the potential drug related problem. And it is an important element of healthcare team and should be integrated with other elements of the healthcare. And pharmaceutical care mainly involves providing direct benefit to the patient. And since it is directly related to the patient, pharmacist is the major person who will be involved in providing the pharmaceutical care. So what all are the criteria for a pharmacist so that he can provide this pharmaceutical care in an elaborate or a convenient manner? First point is he should have a proper knowledge and skill in pharmaceutics, which mainly involves the different dosages, dose calculation, manufacturing of different kind of formulation, and a thorough knowledge in clinical pharmacology, where the mechanism of action or the toxicity related to different drugs may be there. Second one is he should be able to mobilize the drug distribution system by means of which proper decisions can be implemented. He should be able to develop a proper professional relationship with the patients as well as other healthcare professionals, which include doctors, nurses, physiotherapists, and all, which helps in providing pharmaceutical care. He should be always available for a particular patient in the community or the society, and he should have a proper commitment for the improvement of health of the patient, which help in assessing the procedures. Next one is what are the different process of pharmaceutical care plan. First one is establishing a direct or a proper relationship between the patient and pharmacist. For establishing this relationship, first one is we have certain kind of data collection forms which helps in collecting the data related to patient. And these data can be obtained directly by interviewing the patient and sometimes from the healthcare professionals and sometimes from the family members. Once this data has been collected, it has to be properly interpreted. Drug related problems has to be identified. So there can be more than one drug related problem. So next step is how the priority of drug related problems are identified. So for any kind of drug therapy, next step is we have to decide the outcome. If it is an anti-diabetic drug, the desired outcome is reducing the blood sugar value. If it is an antihypertensive drug, the therapeutic outcome is reducing the blood pressure. Then based on that, we have to design the therapeutic plan. We have to monitor the therapeutic plan. We have to do the proper follow-up for the pharmaceutical care plan. So first step, collection of patient's data. So what all details has to be collected regarding a particular patient? Patient's general health history, his activity status, any kind of past medical and medication history, his social life, whether his smoking habit is there, he's alcoholic, about his diet, whether it's vegetarian or non-vegetarian, about his lifestyles, exercises and all. What is the current illness? What is the financial background of the patient? It can be collected either from the patient's case sheet, by interviewing the patient, and sometimes by asking to the family members. So what are the elements of patient information data? It includes patient's demographics, that is age, sex, height and weight, current problems, which is known as signs and symptoms, past medical medication history, any kind of food allergies or drug allergies, any kind of drug intolerance, whether the patient comes under the category of pregnancy or lactation, different kind of social habits, economic condition, any kind of relevant lab data or abnormal lab values also has to be documented in the patient's data collection form. Next one is identifying the problems. Once we have collected all the data regarding the patient, we have to see whether the patient is able to get positive outcome. If the patient is not able to get positive outcome, if negative outcomes are happening for the patient, what can be the causes for this negative outcome? Whether it is due to the current drug therapy, whether it is due to some errors in the drug administration technique, whether the patient is not able to follow the drug properly, that is known as drug compliance, whether the drug has caused any kind of toxicity to the patient or adverse drug reactions to the patient, or if the concentration of the dose was not correct, due to which he was not able to achieve the desired outcome. That has to be documented. Next one is drug-related morbidity, which is a very important problem or a negative effect associated with the usage of drug. Related morbidity is nothing but failure of the therapeutic agents to achieve the desired therapeutic outcome, which includes treatment failure or development of any new kind of adverse drug reaction. Drug-related morbidity, if it is not properly treated, it can lead to drug-related mortality, which is an ultimate disaster. So what are the different drug-related problems? Sometimes for a particular indication, a drug has not been added by the physician, so a new or additional drug is required. Sometimes for a particular indication, a wrong drug has been prescribed for the patient which he is allergic or which can lead to drug interaction. Sometimes the dose won't be correct. Too little of the dose, too much of the dose of a particular drug can lead to problems. Patient has developed any adverse drug reaction due to the usage of particular drug. Patient was not compliant and he was not taking the drug properly. And sometimes for any kind of indication, drug itself has not been indicated. Next one is establishing the outcome goals. So any kind of drug therapy or for a pharmacotherapeutic plans, positive outcomes are there, negative outcomes are there. Positive outcomes are nothing but beneficial effect of the particular drug which helps in reducing the particular disease condition. Negative outcome is nothing but the particular usage of a drug can lead to any kind of side effects or adverse drug reaction. As I discussed earlier, the drug-related morbidity which can finally leads to drug-related mortality. So here some examples are there where positive outcomes has been mentioned for each disease condition. For hypertension, the positive outcome is decreased risk of the causative factors, that is myocardial infarction, stroke or arrhythmia. Next one, for ischemic heart disease patient, what is the positive outcome is fewer anginal attacks or reduced risk of sudden death has to be given importance so that ischemic heart disease cannot happen to the patient. For a patient with peripheral vascular disease, what are the positive outcomes? Better circulation and decreased need of circulation. Diabetes, fewer hypoglycemic events should be there for a diabetic patient, as well as complications should not take place. And for asthma, the asthmatic attacks should be reduced or less, and less hospitalization should be there for an asthma patient. This one is sometimes a patient can have a curable disease, but due to the presence of we cannot prescribe a particular drug for that disease condition. So for example, a patient having diabetes and allergy. Usually for allergies, we are giving corticosteroid, which is an anti-inflammatory agent. But if the patient is having a comorbid disease condition, diabetes, these corticosteroids can increase the blood glucose value. So we have to give corticosteroid, which is the first line therapy, but cannot be given. So that is one problem. Another one is patient with diabetes and asthma. For asthma, we are usually giving steroids in the form of inhalation. But again, if he have a comorbid disease condition like diabetes, steroids cannot be given because it increases the blood glucose value. And therefore, it is very important to educate the patient regarding the outcomes of drug therapy. Any drug, when it is taken by patient, two possibilities are there. Either it can lead to positive outcomes or negative outcomes, which both should be aware by the patient, and it has to be conveyed by the pharmacist. Then evaluating the treatment alternatives by modifying the therapeutic plan. Once patient has taken a particular therapeutic plan, the be modified so that the patient has to get positive effect as well as drug has to be slightly changed. So while choosing an alternative therapy, we have to see the efficacy of the alternate therapy, the safety parameters, cost of the therapy, and suitability of the therapy to the patient. And some here risk benefit factors are there. Some of the factors which has to be considered while deciding the alternate therapy is seriousness of the disease, whether alternate therapy has to be given, consequences if we are not treating the disease with an alternate therapy, the efficacy of the alternate drug, ADS associated with it, then efficacy of the non-drug therapy, lifestyle changes, whether it can cure the disease, side effects of the alternative drugs. So it has been seen that when we are modifying the treatment plan, so this kind of modification helps in reducing the particular conditions or the duration of stay in the hospital as compared to those kind of treatment where modification has not been made. So there are many case studies which indicates that if modification of therapeutic plan is made for the patient and if pharmacist is regularly monitoring that patient, the hospitalization duration has been reduced. Individualizing the drug regimen. For each patient, the drug therapy should be different, dose should be different, depending upon his personal health condition as well as the disease conditions, comorbid disease condition. So patient factors include what is the diagnosis of the patient, what are the treatment goals needed, what are the physiological, pathological factors, past medical and past medicines received, any kind of contraindications is there for the patient, patient's allergies, allergy condition, patient whether he is able to take the medicines properly, is compliant or not, how is cooperating, and special consideration whether he belongs to pediatric or geriatric. Drug related factors while individualizing the regimen, we have to see the efficacy of the drug, adverse effect of the drug, ability, prevalence or ability to minimize the particular disease condition, how the drug can lead to less ADA, drug-drug interaction, what is the pharmacokinetic parameter of the drug, dynamic parameter of the drug, what are the routes in which the drug can be administered, what is the total cost which the patient has to spend for purchasing or usage of this particular drug, any kind of insurance payment is available for this particular drug. Like that, based on these almost 19 parameters, we have to individualize the drug regimen. Monitoring the outcome is very important, as I said earlier, which ultimately decides the quality of life of the patient. For monitoring parameters are the to cure the disease, to reduce the symptom, to slow down the disease progress, and to prevent the disease. And sometimes we have seen many cases suboptimal outcomes has been observed due to the following condition where patient is not able to unnecessary prescribing of drugs by the physician, inappropriate drug regimen. Sometimes drug has been mentioned but is not available at the pharmacy, any kind of dispensing errors. Patient's non-compliance, inappropriate behavior by the patient, then inappropriate non-compliance of the drug treatment, patient's idiosyncratic condition due to which he develops ADA, inappropriate monitoring by the healthcare team members. So, inappropriate monitoring by the healthcare team is considered as a major reason for failure to produce the therapeutic outcome, and failure to monitor the drugs, especially with narrow therapeutic index, can lead to many kind of negative outcome because drugs with narrow therapeutic index like digitalis or theophylline, which is usually given to reduce arrhythmia condition or for shortness of breath, if it is not properly monitored, the concentration of this drug, if it is slightly varied also, it can lead to the toxicity of theophylline or digitalis. So it has to be properly monitored by the healthcare team. So monitoring outcomes involves 4 major S, that is monitoring the signs of the patient, symptoms, side effects, and consequence. Consequence is also known as sequel. So this applies to all disease. So monitoring parameters where the patient is developing any new kind of signs, any new symptoms, any side effects, and sequel. Documentation of information. So what all things has been monitored for this particular patient, whether any side effect, regularly updated for each patient, which is a very critical component of pharmaceutical care. Documentation is important for many reasons, which helps in improving the quality of life for the particular patient, as well as there is a proper record regarding the entire treatment which is given for the patient, which in future also, if it is needed, we can refer it properly. So this is about the provision of providing pharmaceutical care, how it has to be given, as well as what are the parameters needed for providing pharmaceutical care, or what happens to the patient's condition if pharmaceutical care is not being properly given. So that is all for the session. Thank you.